And so when I say that, I'm even more bewildered than when you said at the beginning, well, if we have good data that shows that light therapy and light, getting people out into the sun actually can improve the discharge. We had that, as I said, that study from Brazil where there was a randomized controlled trial and they used 15 minutes of, they actually made this jacket that they put on the patients and they flipped it on with some patients and they didn't flip it on with others.
The jacket was a light
It
jacket?
was an LED jacket that was giving light out at 940 nanometers, infrared light. So you can't even tell if it's on. And as I said, the milliwatts per square centimeter was like 2.9. So you wouldn't even feel it. But yet, these patients, when they were done, 7 days, 15 minutes a day, they had better oxygen saturation. They could take deeper breaths, longer breaths. Their heart rates, their respiratory rates improved. Even their lymphocytes improved, the ones that are very important for fighting off COVID-19. And so at the very end of all of this, the average length of stay in the control group was 12 days, about 12 days. In the intervention group, it was 8 days. How much does it cost to spend 4 days in a hospital?
It can be outrageously
It's outrageous.
expensive.
It's potentially possible. And this is why I think really people need to understand this, not just people who are wanting for their own care, but people who are in charge of hospitals, people who are in charge of healthcare in this country, is understanding that I believe, why I'm happy to talk about this, is I think that the lowest hanging fruit potentially, after you look at that graph of deaths throughout the year, is encouraging sunlight in people, especially in those that are hospitalized and sick.